Hello, everybody. This is Lucas Smith. I am the one of two sons of Patrick Smith, actually his favorite son. And I wanted to give you an update on his current medical status. As you know, he went into the hospital in Sault Ste. Marie on October 31st with COVID symptoms and was diagnosed with COVID. And he had kind of a rocky stay there at the hospital. And then on the Friday after Thanksgiving, we received a phone call from the doctor that was taking care of him that 90% of his lungs were not working correctly. And it was not a good situation. In fact, we were looking at plans for end of life. And the doctor told me that the two options we had were to leave him on 100% forced oxygen, and he could live a couple weeks maybe. He would develop pneumonia probably and pass away that way, or they would put him in comfort care and he would have the choice to take his oxygen out, and then it would be a matter of hours. So we had the conversation as a family, and we talked about things and worked through the weekend and all the details that came up with that. It was that Sunday evening that I was planning his funeral. We had accepted the fact that this was going to be the end, so we made the plans accordingly. However, Dr. Rashad Farah came in on his round that Monday and met my father, and I brought Rashad in on this Zoom call today to talk about a few things. But the reason we're here is because we're celebrating, we're praising God for a miracle. We were planning Dad's funeral, and today, currently, right this second, he is en route to a rehab facility to finish out his rehab to make a full recovery. So within 3 weeks, we went from planning the worst to celebrating the best. And a lot has to do with the people involved at the hospital up there, but specifically Dr. Farah. And I just wanted to give him the floor a little bit. I was going to ask him a few questions and let him introduce himself, but he's a hospitalist with the Henry Ford Hospital's health system down in Detroit area, and he does rounds up in Sault Ste. Marie at War Memorial Hospital also. So without further ado, Doctor, tell us a little bit about yourself, maybe how you got into medicine, what brought you, and how you crossed paths, and why you were in Sault Ste. Marie. But yeah, we'll give you the floor here for that.
Thank you, Lucas. So I guess if you're his favorite son, I'm his favorite doctor, right?
Yep.
So I'm Rashad Farah. I'm board certified in internal medicine. I went to medical school at Toledo. I kind of been around Southeast Michigan my whole life. Medical school in Toledo, residency training at Henry Ford, which I finished in 2017. I actually initially was going to sign on as a full-time physician at Henry Ford. I did some what we call locum work, where we fill in for other doctors, and a recruitment company took me to the UP, and I worked a 10-day stretch in August, and it was beautiful, like the UP always is in August. And they convinced me to sign a full contract for 3 years, and actually, which just ended a couple months ago when I re-signed for another 3. So that's kind of how I got to the UP.
And can you expand on a little bit of the terminal condition my father was in when you met him, when you came up to do your work there for that week, and kind of what was your mindset and your strategy knowing his condition, and maybe talk a little bit about the medical dealings that went on?
Yeah, sure. So as we all know, COVID-19, essentially a viral infection that is novel, new, and it's kind of plagued us for the past several months. He was diagnosed, I believe, sometime before he was admitted to the hospital. And like a lot of people, after the initial infection, some people, get better and, they beat the infection, and some people go on to a much longer struggle with the disease, which is mainly an inflammatory cascade that affects the lungs. So when I came on to service, I think he had been there for over 30 days, or maybe it was 30 exactly when I came on. And he was on the maximum therapy oxygen that we can give him before putting him on life support, a mechanical ventilator. So that included what is called high flow oxygen. And the reason they call it that is because it has a pressure system, and he was receiving the maximal pressure, which was 40 liters of flow at 100% of oxygen. And on top of that, he had what's called a non-rebreather, which is a mask that goes above this machine. So this was basically the maximum oxygen therapy he could have received. And even on this maximal oxygen requirements, if he moved his arm to grab his phone or even try to get something to eat, his oxygen saturations would drop in the 70s. So he was quite ill. His lungs were severely damaged, which is what we see in a lot of COVID-19 patients. So essentially it's called COVID-19 pneumonia. Pneumonia is any disease of any infection of the lung. So you can have a bacterial pneumonia, or COVID-19 can give you pneumonia, as well as influenza, like the regular flu can give you pneumonia. And that's what he had.